नमस्कार दोस्तों, welcome to channel Toxicology on board. Today we'll discuss the topic organophosphate insecticide, hen, chicken, OECD guideline 419. In this video, we'll be discussing about around 16 DABT questions which were taken from DABT recertified question papers from 1999 to 2009. Okay, so let's directly dive into the question. This question is taken from American Board of Toxicology, Design, Execute and Interpret Toxicology Studies. Around 50 question quiz paper was uploaded in that ABT site. From this only one of the questions I have taken. So what is the question? The question is, for what type of toxicity study is the hen or chicken used as the test species in the registration package for organophosphate insecticides? Okay, so important thing here you have to understand from this question is that we have to identify the test species, okay, which is used for for the purpose of registration package for organophosphate insecticides. So let's see what are the options. Option A, teratogenicity. Option B, acute delayed neurotoxicity. Option C is 90-day oral toxicity. Option D is acute oral toxicity. So right answer is option B, which is, and the explanation and reference is given by ABT, American Board of Toxicology only. So the explanation given by them is chickens are the sensitive species for cholinesterase inhibition. So in this video now you need to understand how the cholinergic enzyme, cholinesterase enzyme, it is acting on acetylcholine at the synaptic cleft, that you have to read in detail. Okay, chickens are the sensitive species that you have to see. And next important thing is adult hen is required for animal model for this essay, not the young one, that is also. And under OECD guideline 419 and US EPA health effects test guideline. Okay, so these are the two important guidelines, which is OPPTS 870.6100. Okay, so you have to remember OECD guideline 419 and EPA guideline for pesticide registration, that is OPPTS 870.6100. Additionally, with respect to with along with OECD guideline 419, I would request you to also remember OECD guideline 418. Okay, uh, this is taken from Clayson 8th edition, page number 938, table 222.7. Okay, so I have also included here for your easy understanding. I have included table 22.7. Okay, we'll read in detail what are the contents in this particular table 22.7, so that not only with respect to this question, other species as well as test also we will be learning in from this table 22.7. Okay, so let's see. This table consists of basic toxicology testing requirements for pesticide registration. So you have to understand pesticides includes herbicides, weedicides. Okay, they also include insecticides. Though our question is related exclusively related to insecticide, but this table or this test as well animal species are belong to all pesticide, all classes of pesticides. Okay, so if you look at the test type, if you are doing acute lethality, oral, dermal or inhalation route, the animal species recommended is rat, mice, guinea pig and rabbit. If the test is dermal irritation, the preferred species is rabbit, rat and guinea pig. And if the test assay is dermal sensitization, then animal species preferred is guinea pig. See here, in case of sensitization, GPMT assay is there. There is no LLN assay, local lymph node assay. Okay, that is a difference you can see. And in case of eye irritation test, rabbit is a preferred species, acute delayed neurotoxicity hen. So the right answer here is acute delayed neurotoxicity hen. So here you can see, right? And if you see option D, acute oral toxicity, we have learned here rat, mice, guinea pig, and rabbit are the preferred species. So if you read this table, all these four options you will be able to understand. And for genotoxic test, both in vitro and in vivo, we have bacteria, mammalian cells, mouse, rat, and Drosophila. So it might be Ames assay, micronucleus assay. This type of assay might be included in the case of genotoxicity test. Coming to teratogenicity, the preferred species is rabbit, rodent include mice, rat, and hamster. So here, if you see option A, teratogenicity, which includes what segment 2 studies. Okay, you have in case of reproductive developmental studies, you have segment 1, segment 2, and segment 3. Here we are talking about segment 2. Segment 2 is about teratogenicity, which include embryo fetal developmental study, in which the test item is exposed during organogenesis period from gestation 6 to 17 or 6 to 16 or 6 to 18. Okay, so here the preferred species is rat and rabbit. Coming to next one, 2 to 4 week toxicity study, oral dermal inhalation. So here is talking about 14-day to 28-day repeat dose toxicology study, and here the preferred species is recommended species is rat and mice. Coming to 90-day study, but oral route, rat is the preferred species. Okay, and coming to chronic toxicity study, oral 6 months to 2 years. Okay, rat and dog are the recommended species. Coming to cancer study or oncogenicity carcinogenicity study, rat and mice are the species. And reproductive fertility study, as I said, segment 1 के लिए rat is the one in which the test item is exposed uh, before mating, during mating, till certain times. It is also like fertility, early embryonic developmental study. Okay, and last one is developmental neurotoxicity study. The selected recommended species as per the regulatory is rat. Okay, hope from this table 22.7 you were able to understand the type of test and the type of animal species that need to be so here is option C also you can see 90-day oral toxicity study. Here you can see 90-day oral toxicity is rat. So here it would have been rat and rabbit. Here it is N. 90-day oral toxicity again rat. Acute oral toxicity based on the route of administration. Oral dermal inhalation again rat, mice, guinea pig, rabbit will be there. So this was the explanation and the given by ABT. Let's dive into more detail all the related information, the concept related to this particular question. Okay, so let us understand what is delayed neurotoxicity. So delayed neurotoxicity, it is a syndrome associated with prolonged delay onset of ataxia, distal axonopathies in spinal cord and peripheral nerve, and inhibition and aging of neuropathy target esterase in neural tissue. This is very important. NTE, that is neuropathy target esterase. Throughout this video also you'll come across this term NTE. Okay, so what is happening exactly in the case of delayed neurotoxicity is that there will be a delayed onset of ataxia, distal axonopathy. If you look at the nervous system, no, our entire neuron, it is made up of a myelinated sheath, axon, dendrites. The based on which part of the neuron there will be pain. Pathy is something related to the pain. So here axonopathy, the site of action is an axon. That is why it is saying, and also it is important proximal and distal. So here it is towards the end of the neuron. That is why it is called as distal axonopathy in spinal cord and peripheral nerve. Okay, inhibition aging of neuropathy. So aging related cholinesterase esterase inhibition also you will learn in detail in this particular video. Next, coming to organophosphorus substances include uncharged organophosphorus esters, thioesters, anhydrates of organophosphoric, organophosphoramidic acid, or of related phosphonothioic, phosphorothioamidic acids, or other substances that may cause neurotoxicity, sometimes seen in this class. So very important, you have to remember in your this thing, organophosphorus substances. These are the various classes of organophosphate, and majority of the pesticides, if you see, one of the major class of pesticides is organophosphorus pesticides. It might be it may be organochlorine, it might be organophosphates, it will be. So you have to remember like that. So as we say, as our focus was more towards OECD guideline 419, It was came into implementation in 1995. If you look at the title of this particular guideline, you can see delayed neurotoxicity of organophosphorus substance, 28-day repeat dose toxicity study. So as the name implies, it is a 28-day repeated administration. Here the test item is organophosphorus. Okay, and the test species is hen. And the type of particularly target organ which we are focusing is neurotoxicity. That is particularly delayed neurotoxicity, not acute. Okay, that you have to remember. Along with OECD 419, you also have to remember EPA. As I said in the first slide only, even the ABT has given the explanation. OPPTS guideline 870.6100. The title is Acute and 28-day Delayed Neurotoxicity of Organophosphorus Substances. Here also delayed neurotoxicity of organophosphorus substances. I would request you to read both this guideline in detail. If you look at OECD 419, it is not a big guideline, only around 7 pages guideline it is there. First page, title page, as well as last 2 pages will be about the reference and definitions only. So majorly 2 pages or hardly 2 to 3 pages only will have. And those people who have already read about OECD guidelines, like for example 407 or 408, they will know the same pattern will be there. Background, introduction, and principle of the test, procedure, observation, test results, reporting. So the same sections, most of the thing will be repeated only. Okay, major important points in the case of this OECD series of guidelines, if you remember how the each guideline is differing from each one, if you remember, it will be very useful at the time of your exam. Okay, coming to let's since we cannot read in detail 419 guideline in this video, let us focus on only main important point that we have to remember from the exam point of view. Coming to principle of the test, what is happening? Daily doses of the test substance. Here the test substance is organophosphorus substance are administered orally to domestic hens for 28 days. As I said, here the test species is hen, and here the treatment duration is 28 days. Okay, continuously from day 1 to day 28, the test item is administered to the hens. Okay, repeated administration. The animals are observed for at least daily for behavioral abnormalities, ataxia, and paralysis. As you can see, these are the main important ataxia, okay, paralysis. So these are the observations that has to be seen during this particular test until 14 days after the last dose. So if the last dose was on day 28, then additional after day 28 without tested administration, another 14 days you have to observe. Okay, observe for these kind of behavior, what behavioral abnormalities, ataxia, and paralysis. Biochemical measurements, in particular NTE, as I said, no, neuropathy target esterase, are undertaken on hens randomly selected from each group, normally 24 hours and 48 hours after the last dose. For example, the last dose was on day 28. On day 29 or day 30, you have to check for this NTA activity. Okay, 2 weeks after the last dose, the treatment of the hens are the remainder of the hens are killed, and histopathological examination of selected neural tissues is undertaken. If you see a typical OECD 407 study, no, what happens in this case? After day 28, the last day of 28-day dosing, day 29 all the animals will be sacrificed except for the animals which are kept for a recovery group. Okay, but here what is happening, this is a slight difference. 2 weeks after the last dose, this day 28 is over, then next after plus 14 days, like day 42, the remainder of the hens are killed, and histopathological examination of the selected neural tissues. Here important is the target organ is neural tissue. In that also we'll be seeing about sciatic nerve, that you will be seeing. Let's see what are the initial considerations given in the OECD 419 only. This guideline is used in the assessment and evaluation of the toxic effects of organophosphorus substances, that we have understood. Usually the delayed neuropathic potential or repeated exposure is determined after acute tests. Okay, so as I said, along with 419 guideline, you also read OECD guideline 418. Information from acute test for delayed neurotoxicity and other tests may be useful in planning repeated exposure studies. So you have seen that in case of typical 28-day oral toxicity study also, before doing the actual study, no, we'll be doing dose range finding study, or we'll be doing non-GLP studies. Okay, short duration studies we'll be doing, so that the doses from these studies will help us to decide the main doses for the actual study, right? So similarly, he is saying that if you do a 418 study, the doses from this 418 will help you to decide about the doses for the OECD 419 study, it is saying. Okay, this 28-day delayed neurotoxicity study provides information on possible health hazards likely to arise from repeated exposure over a limited period of time. Okay, it will provide information on dose response, so you will be able to understand the dose response curve, so because of which you will be able to establish NOAL or LOL, and can provide an estimate of NOAL which can be used for establishing safety criteria for exposures. So this is very very important, as you know that in case of pesticides you need to derive MRL, maximum residue level, as per ATSDR. Okay, you have to, because these pesticides they have a scope, they have they might be retained on your food products also. So the final consumer is human being, so you need to establish some safety limits. So for that you need a point of departure, that can be, you can get it from this particular study. Okay, so if you are able to establish dose response curve, you will be able to establish NOAL. This NOAL can be used in derivation of either MRL. Okay, maximum residue level for the pesticides you can establish. Let's see what are the main observations given in the OECD 419 guideline. Observation should start immediately after the treatment begins. Okay, from the day one only you have to start observing the animals. Is there any effect of this organophosphate pesticides onto the hens or not? All hens should be carefully observed at least once daily on each of the 28-day treatment. Okay, so daily observation should be there. And similarly, like OECD 407 study, you can see. And for 14 days after dosing, or until scheduled kill. Okay, necropsy till you perform. All signs of the toxin should be recorded, including their time of onset, time, severity, and duration. This is similarly like in OECD 407. Observation should include but not be limited to behavioral abnormalities. Okay, ataxia should be measured on a ordinal grading scale. So please go back and read what is this grading scale. For example, in the case of skin irritation or eye irritation, skin sensitivity, scoring system will be there. So similarly, probably in this case also there is a grading scale is there, ordinal grading scale. So please go back in detail and read, because I have not worked on this particular type of test, so I am not much aware of it. So you please, those people who are working in the area of pesticide registration or pesticide industry, these people will have much more awareness about it. At least four levels, like we know, okay, the grading system is on 4 levels, he say, and paralysis should be noted. At least twice a week the hen should be taken outside of the cage and subjected to period of forced motor activity such as ladder climbing, in order to facilitate the observation of minimal toxic effects. So here what, no, in the case of 407 also study, 407 is repeat dose oral toxicity study in the case of rats. What happens, you take the rat outside, you will do field observation. You take the rat outside the cage, put in open field observation, you will say, where arena will be there in which your rat will be kept, and you will be observing these things, like piloerection, how the movement is there, whether they're doing response to twitching, startle, all those things will be there. No, similarly in this test also it is stating that we need to take the hen outside the cages subject to period of forced motor activity, ladder climbing. See, ladder climbing is, I don't think it is there in the case of rat or mice. I am not much aware of it, but there will be field, sorry, grip strength, such kind of observation, such kind of FOB parameters will be there in the case of rat study. Probably in this case they are saying ladder climbing in order to facilitate the observation of minimal toxic effect. Any moribund hen should be removed and killed and subject to gross necropsy. So this is a thing. So I will not discuss more in detail about 419 guideline. I would request you to go back and read in detail yourself. Only 7 pages guideline. There is no update after 1995 also. So please go back and read. Then next, a very important concept let us try to learn here is acute delayed neurotoxicity in the case of health, particularly after exposure to organophosphates like triorthocressyl phosphate. So TOCP is an example for organophosphate pesticides. So what is happening is this TOCP is causing acute delayed neurotoxicity. Okay, it can lead to syndrome called ginger jake paralysis. So this word also you keep it in your mind, ginger jake paralysis, characterized by ataxia and other neurological issues. So what has happened is bootlegged alcohol, Jamaican ginger ale, which contained TOCP as a contaminant. This particular alcohol, no, they contained TOCP, this triortho cresyl phosphate, which is a neurotoxin by itself. So this was a contaminant in this. So those people who consumed this alcohol, they got neurotoxic syndrome. Around 30 to 50,000 people were affected by this contamination in the US. If you go back, this is a historical incident. You can go back and read in detail about this one. So what is the main mechanism have occurred with respect to TOCP is TOCP causes an axonal dying back neuropathy. As I said, no, neurons will contain myelin will be there, then myelin sheath will be there, dendrites will be there, axon terminals will be there. So what is happening if you if you see here, I will say this is a typical axon dying back is from axonal from distal end, the dying back was taking place. Axonal dying back neuropathy primarily affecting large muscle groups leading to paralysis. So large muscle groups will be, you know, sciatic nerve. This particular one got affected. Okay, so let us understand what is dying back. Dying back refers to a type of axonal degeneration where damage progresses from axonal distal end, from this end, synaptic region towards the cell body. This is your cell body, nerve cell, if you see, often seen in neurodegenerative diseases and after the trauma. So it can also be because of the chemical as well as physical agent also, it is saying. So hope you understood about ginger jack paralysis. This is the one which is OPINT. It is called organophosphorase induced delayed neuropathy. It is all. See here you can see dying of neuron is taking place. This is the organophosphate which is inhibiting the acetylcholinesterase enzyme. As a result, acetylcholine levels in the synaptic cleft will increase. So because of which we will have cholinergic syndrome. All the typical symptoms of cholinergic syndrome that we will read in the next slide. Okay. So this is the longest one of that sciatic nerve getting affected. Okay, so let's see next one. So till now we have learned about the delayed neurotoxicity. Okay, so let us understand what is neurotoxicity. Just one or two slides will understand what is neurotoxicity. Neurotoxicity is defined as adverse changes in chemistry, structure, and function of the nervous system. This is very important. Even chemistry structure means if there is a damage in the case of there is a damage in the case of myelin sheath, such damage, structural changes, even function also, whether the propagation of signals, transmission of signals, if it is interrupted, that also, following exposure to chemical or physical agent. Certain time physical injury will also cause neurotoxicity, right? Next, neurotoxic effects can occur in central or peripheral nervous system. So this is your central nervous system, pink one, and this is peripheral nervous system. So it can affect to both the systems and disrupt sensory, motor, autonomic, and cognitive functions. So memory also will get impaired because of this neurotoxic effects. Okay. Next, the developing nervous system is particularly sensitive to chemical exposures. This is very important. So what type of species you have to do, whether you have to do in adult species or you have to do in juvenile species, this is important. Developing nervous system is particularly sensitive to chemical exposures. Therefore, testing on adult and prenatal or juvenile animals is important in assessing the potential risk of neurotoxicology. So it is saying that juvenile animals, prenatal animals are also important species to conduct the neurotoxicity studies. Okay, the functional observation battery, again very important. FOB was developed based on early basic screenings for behavioral function in the case of mice. Okay, FOB used in young adult rats by the EPA evaluate changes in number of endpoints. What are those endpoints? Autonomic functions, which include lacrimation, that is more amount of tears shedding from your eyes, salivation, okay, piloerections where animals will show like this, then exophthalmosis, which is related to eyes, more protruding of eyes, then urination, frequent more urination, defecation also, and pupil size also, whether it is constricted or dilated, that you have to see. Abnormal motor movements, reactivity to stimuli, level of activity, gait, forelimb and hind limb strength, foot play, and others. So how they are holding a certain thing, that strength you will be checking. Okay, level of gait, posture, all those things you'll see. Some of the pictures I have kept towards the end of the presentation. You will understand what are this, and those people who have worked on FOB, they will definitely know what I am trying to say here. In addition to the FOB, motor activity and neuropathology. Okay, the histopathology of the nervous tissues is also assessed during these studies. These studies are performed in at least 10 rats for each sex. Okay, 10 males, 10 females, using at least three dose levels as control, low dose, mid dose, and high dose compared to vehicle control group. Because of the heightened sensitivity of immature animals to the neurotoxicity of some chemicals, there are a number of methods and procedures to evaluate developing neurotoxicology. So, what type of test in which you can do this developmental neurotoxicology, that we will see in next slide. So, standardized protocols are used to evaluate developmental neurotoxicity in offspring from pregnant and lactating rats exposed prenatally to test chemicals. Okay, these protocols include test of neurobehavioral function such as auditory startles, where you will check near the ear of the learning and memory function. There will be some maze, swimming test, such kind of FOB studies will be there, where we will see how much the animal is remembering, learning and memory function, changes in motor activity, neuropathological examination, morphometric analysis across multiple age ranges, pre-weaning, adolescents, and young adults. So you can see that the distribution from pre-weaning till young adults. Okay, 2012, this OECD approved extended one generation reproductive toxicity study. This is important. I will give you the what is a guideline number, then you can understand. A main disadvantage, main advantage is that criteria are described that may document that a two generation study is not needed. Okay, so this is very important. So based, see, one generation study was there, two generation study of there. Because of the implementation of this extended one generation toxicity study, there is a no longer need for two generation study, it is stating, thereby reducing the substantiality and number of animals and the cost of study. So this is again very important, that as per animal ethics committee, you can say you can reduce the number of animals by decreasing the particular study also. Okay, this document states that decision whether to assess the second generation and to omit the developmental neurotoxicity cohort or developmental immunotoxicity cohort should reflect existing knowledge for the chemical being evaluated, as well as the needs of various regulatory authorities. Before performing any study, look for the literature available on the existing chemical data, it is saying. Okay, so you read in detail, because lengthy the video is becoming. As I said, this is the OECD 443 guideline, uh, as given in the previous slide. No, extended one generation reproductive toxicity. So this is a typical design. You can see the dosing is taking place from pre-weaning till post-weaning. Here the parents from female as well as male is there. So 20 liters per group, you can see here they have given cohort 1A. Important thing you have to remember is 2A and 2B, which is for neurotoxicity, and in particularly 2B may neurotoxicity, there is no sexual maturation, no, it is given. And this is the approximate age at the necropsy at 13 weeks or 3 weeks, 2 weeks. So this study design you can clearly read in detail in 443 appendix A. If you see measures and observations included in the FOB, some of the FOB parameters we have discussed in the previous slides, you have seen. You have to check for the, these are the home cage and open field observation. As I said, no, animal will be taken. Some of the observations you will see the animal keeping inside the cage without disturbing them. Some of the observations you will take the animal out, put it in an open field arena, and you will observe. What are the observation is posture, how the animal is, involuntary clonic and tonic movement, palpebral closure, that is mouth, you will see piloerection, animals are like this, you will see salivation, lacrimation, vocalization, rearing. Okay, gait abnormalities, arousal, stereotypy, bizarre behavior, stains, if there are any on the fur, any stains are there, that you will see, and respiratory abnormal, while breathing, if the animal is making some kind of sound, or all those things are also you will be observing in this case of open cage and open field observations. So these are some you have to, if you are a typical preclinical toxicologist study director, you will be definitely in your SOP also at your clinical CRO you will be have, you have to identify what is a normal animal, what is an abnormal animal. So like this, some pictures, some kind of behavioral thing will already be there in your SOP. From that you can understand, okay, this is a typical rat body language. And here you can see sensor is there, piloerection is there, okay, reflexes how they are. The next you will see manipulative, ease of removal, is the animal easy to remove from the cage, ease of handling, whether are they showing some aggressive behavior or not. Then muzzle tone, approach response, whether the animal is coming towards you or going away from you, okay. Touch response, auditory response, as I said, they will check like this. Then tail pinch, they will pinch the end of the tail. And writing response, land food display, yeah, that stamp will be there on which animal food will be kept. And it will be checked on a plain paper. Four limb grip strength, again separate instrument will be there where you will be checking four limb, whereas hind limb grip strength will be there. Coming to physiologic, we will be checking temperature, body weight, pupil response, and pupil size. Okay, so let's see next one. This slide I will not discuss in detail because the video length is becoming a bit high. So this is the taken from Clayson 9th edition only, page 1082 and 1064. Okay, these are the examples given, structures of some organophosphorus insecticides and of the nerve agent sarin. So this is very important. Sarin is the chemical warfare agent which was used during German and Nazi war during World War II. It was for mass killing it was used. Okay, and sarin by you will have P double bond O structure is there. And coming to important thing is P double bond A structure. These are the five that like this methyl parathion, chlorophyll, diazone. These are the important five one where P double bond S is there. Okay, and uh, if you look at table 22.9, no, these are the signs and symptoms of acute poisoning with anticholinesterase compounds. Okay, so for example, this acetylcholine is there. If you are inhibiting this enzyme anticholinesterase, so what happens? Acetylcholine will not break. Acetylcholine level will be increased in the synaptic level. Then what is we will have cholinergic syndrome. So then what kind of symptoms you will be having, that we will see. So site and receptor affected and manifestation. If you see exocrine glands, okay, this is related to uh, uh, they, the type of receptors here is muscarinic receptors. It is causing increased salivation, lacrimation, perspiration. Coming to eyes, the receptors are muscarinic receptors and it is causing meiosis and blurred vision. Okay, and coming to gastrointestinal tract, they are abundant with muscarinic receptors and it is causing abdominal cramps, vomiting, diarrhea. Okay, diarrhea important thing. Cholinergic syndrome. Okay. Respiratory tract, again they are abundant with muscarinic receptors and they are causing increased bronchial secretion and bronchoconstriction. Coming to urinary bladder, abundant with muscarinic receptor, they are causing urinary frequency and incontinence. Coming to cardiovascular system, heart, it is having both muscarinic receptor as well as nicotinic receptors. So muscarinic receptors, the action is bradycardia and hypotension. And coming to nicotinic receptors on the heart, the action is tachycardia and transient hypertension. Coming to skeletal muscles, they are abundant with nicotinic receptors and they are causing muscle fasciculation, twitching, cramps, generalized weakness, and flaccid paralysis. Central nervous system, your brain, it contains muscarinic receptor as well as nicotinic receptor and it is causing dizziness, lethargy, fatigue, headache, mental confusion, depression of respiratory centers, convulsions and coma. So you might be thinking why I am discussing in detail about this diagram, because definitely two questions or two to three questions, it's a very much favorite for the ABT questionnaire people is that cholinesterase, acetylcholine, anticholinesterase, acetylcholinesterase enzyme, pseudocholinesterase, cholinergic system, cholinergic syndrome, atropine, scopolamine. So many things they will be asking on this concept. One within this thing, another thing is about adrenergic system. So keep reading, no matter how many times you read cholinergic syndrome, like diarrhea, confusion. One of the options will be there. Then you have to identify the odd one from it. So if you know this table by in your memory, definitely you will be able to answer the question. But the problem is that this concept is very confusing. after certain period of time again you will keep forgetting. So my only suggestion is that keep reading as much as repeatedly you keep reading, and try to answer questions based on such cholinergic, anticholinergic, with examples will be the scopolamine, atropine, like that examples will be there. That will definitely will help you in remembering this concept. Okay, let's directly go to next slide. So next slide, we directly now we are entering into the your jackpot 16 questions from DABT. The questions are taken from the year recertification questions ABT का ही है, from 1999 to 2009. So let's see what is the first question. Ginger jack paralysis resulting from ingestion of contaminated ginger extract was caused by. See, till now in the previous slides I have already discussed the concepts and contents. So all these questions, if you have listened to my previous slides very cautiously, you will be knowing the right answer. Anyways, right answer I am already keeping it green. So you can pause the video, take a screenshot all after all the 4 to 5 questions are there on the slide, so that you can remember well. So ginger jack paralysis, just now we have learned in one third slide something like resulted from ingestion of content. So ginger extract was caused by triardo cressyl phosphate. So TOCP is an example for organophosphate. There was alcohol in the US which was contaminated with the TOCP, and it causes ginger jack paralysis. This is the thing you have to remember. It caused ataxia, gait, okay, posture, something like that was impaired in the case of patient. That you have to remember. Okay. Next question is the most commonly used species in screening for delayed neurotoxic effects of organophosphate is chicken. This is a direct question. Even the first question was also same thing. Dog, cat, mouse, and pig, they are not. Pig is for dermal studies, you can remember. Mice is for, you can say, acute. Cat, I am not aware of it. Dog for repeat dose toxicology, systemic toxicity, you can say. Okay. The next important next question is, which of the following is the most appropriate antidote for organophosphate poisoning? So whenever you are reading about any poisoning, also try to read about the antidotes. You have to remember those antidotes. So in case of organophosphate poisoning, what is the antidote means? Pralidoxamide, PAM, 2-PAM. So read as much information as about 2-PAM as you can. Dimercaprol, it's almost like it's an universal antidote. D-penicillamine is for penicillin class of, I guess. Desferoxamine for iron, I guess. Naloxone is for morphine poisoning. So other 4 options, 4 to 5 options which are also given, you read. If you read, you will remember. So delayed neurotoxicity is not observed with which of the following? So answer is methoxychlor. So this is something related to organochlorine rather than organophosphate. Rest of the thing, either triordocresyl phosphate, bipafox, leptophos, diisopropyl fluorophosphate, they all belong to organophosphate class of pesticides only, and they are causing delayed neurotoxicity. Since this is organochlorine, I believe, so it is not causing delayed neurotoxicity. Like this, you have to remember the examples also. Then next we have question number 5. Organophosphate induced peripheral neuropathy. Okay, can be reversed with 2-PAM? No. Once the damage is done, it is a irreversible damage. It cannot be reversed with a 2-PAM, that is pralidoxamide. Is usually first manifest in nerves with longest axons. As in, I have shown one figure also, longest sciatic nerve. So longest manifest in the nerves with longest axons, can be reversed with atropine. So it cannot be reversed. It can be reversed. It cannot be but it can be reversed with atropine, anticholinergic drug. So option is B and C. Let's see next questions what we have. Question number 6, we have pseudocholesterase activity in the serum is a useful indicator of occupational exposure. For example, you see one worker who is working in a factory and who is dealing with organophosphate insecticide on a day-to-day basis. Okay, and if you're taking a sample from that particular worker, blood sample, and you are analyzing his serum, if you find pseudocholesterol activity, if you find in his serum, then what kind of exposure you might be with? The answer is organophosphate insecticide. This is the way you need to decode the question. Question was, pseudocholesterol activity in the serum is a useful indicator of occupational exposure to organophosphate insecticides. So nitrates, vinyl chloride, DDT, chlorodane, you cannot find any pseudocholesterol activity in the serum. Okay. Next question. Question number 7. All of the following apply to organophosphate insecticides except. So you have to see what are those options. Symptoms of acute systemic poisoning arise from inhibition of acetylcholinesterase. Acute nahi hai, this is delayed actually. Local effects can include meiosis, bronchoconstriction, uh, applied. Sorry. sorry, the first one is correct only. Symptoms of acute symptom systemic poisoning arise from inhibition of acetylcholinesterase. This is true because second option is also same. Local effects can include meiosis, bronchoconstriction, nasal discharge, and sweating. This is perspiration. In the table you have seen no. So organophosphate insects, all these things it is causing. More frequently involved in human poisoning than any other class of insecticides. As I said, if you see the major class of pesticides, no, they contain organophosphates only, and since humans at the time of in the factory also, at the time of preparation of, I mean to say, at the time of manufacture also they are getting exposed, and also you see at the time of application also, because humans are the people who are applying either to the plants or whichever the area of application might be there. So there is a larger chances of getting exposed to these type of insecticides. So more frequently involved in human poisoning than any other class of insecticides. He's saying organophosphate insecticides. The next includes linden, endrain, toxin. This belongs to again organochlorine, not organophosphate. So this option is wrong option. Treatment of severe poisoning should include artificial respiration first, followed by administration of atropine and then 2-PAM. So here again you have to remember, whenever there is some kind of poisoning is there, a patient comes to your emergency department, then you have to identify what kind of poisoning is there and what kind of treatment you have to initiate. So first thing you have to do ABC, that is airway, breathing, and C I'm not remembering. Please go back and check. So here as the option says, treatment of severe poisoning should include artificial respiration first, followed by next you have to give what once you identify the type of poison, you have to immediately go for antidote without further delaying. So in this case of organophosphate insecticides, the antidote is atropine, that is anticholinergic drug, and then 2-PAM, that is 2-palidoxamine. Okay, read how atropine the mechanism and how 2-PAM mechanism is there. You go back and read in detail. Okay, next question number 8 will see characteristic clinical symptoms of moderate organic phosphate intoxication can include all of the following except midriasis. So here the if you remember the table, if you see, it is not midriasis, it is meiosis. The rest of the things are all caused by organophosphate, like nausea is there, vomiting, diarrhea, cholinergic syndrome, urinary frequency, incontinency also was there, salivation, diffuse sweating, this is perspiration. Okay, bronchoconstriction and respiratory impairment, skeletal muscular fasciculation and twitching, effect on CNS and PNS we have seen, no, it is affecting. The next question number 9 we will see, most of the organophosphates used on a large scale in agriculture require biotransformation to unfold their full insecticidal potency. The responsible reaction occurring in insecticide and mammal species is. So for this question, no, you have to read about biotransformation or metabolism, phase 1 and phase 2 metabolism of this organophosphates. If I remember slightly, I remember that there is no much difference the effect these pesticides will act on either insects or in the mammals or in the human beings. So that is what it is trying to say. Okay, occurring in some species is, answer is desulfuration to oxygen analog. Okay, for this question, no, you also have to read the one diagram which I gave about the various chemical structures I have given, no, P double bond O, P double bond S I have given, no. So in this case, no, P double bond is important where desulfuration to an oxygen analog is taking place. So whenever in, see, that is you have to understand, a toxicologist also have to have the knowledge about the chemical structure, what are the functional groups or leaving groups or withdrawing groups, these the chemistry behind the structure also, if you be able to understand, no, you will be able to understand the options and you can eliminate, you can identify the what is the right answer. Okay, so let's see what are the next question number 10. Question number 10, oximes such as pralidoxamide, paridoxam, methoidide, 2-PAM have antidotal action in organophosphate. Which of the following mechanisms? The answer is nucleophilic displacement of organophosphorus inhibitor from the active site of acetylcholinesterase. So if you know the mechanism, you will be able to answer this question. So this competitive inhibition, acetylcholine at the receptor sites, physiological antagonism, hydrolysis of phenol, these are all not related to this particular question. The next we have question number 11, acetylcholinesterase. What are the points, below points applicable to acetylcholinesterase? We have to see. The answer is directly will go to answer is option 1 and 3. So what is option 1? Acetylcholinesterase occurs in erythrocytes, RBC. and can be used as a marker of exposure to organophosphates. In the initial one question was there, in workers is there, they are taking the serum. In that serum you have pseudocholinesterase activity is observed. Similarly, if you know the concept here, here you can apply. So acetylcholinesterase occurs in the erythrocytes and can be used as a marker for exposure to organophosphates. Let's see what is option number 3. Acetylcholinesterase cannot be reactivated by 2-PAM after aging of the organophosphate inhibiting enzymes. So dying back mechanism is there, no? That concept, if you under aging of a neurons, that concept you have to give. Okay. Other two options you people leave. It is not related to pyrethroid. It is not related to carbamates. Okay, aged one. Okay. Next option. Next question we'll see the organophosphates and carbamate insecticides. In this case all are correct, have low dermal toxicity, because again you have to understand, because of the nature or the chemical structure, as well as you see the route of exposure. So through dermal route na, these chemicals the exposure is very less, so have low dermal toxicity. Number two, are equivalently toxic for all insect pests. As I said, no, one question was there, how they're acting on mammals, as well as there is not much difference will be there. So they are equivalent toxic to all insect pests, do not require metabolic activation to produce toxicity or cholinesterase inhibitor. So these all 4 points are applicable to organophosphate as well as carbamate insecticides. The next we have question number 13. This acute poisoning has been most often caused by which class of pesticides? Organophosphate. So acute toxicity, other chlorines, carbamate, phenoxy, pyrethroids, all this will cause delayed poisoning. Okay, chronic poisoning also you can say. Okay, next we will see question number 14. What is the question number 14? Which of the following is true in the treatment of organophosphate insecticide poisoning? Okay, so we have option number 2 and 4 are correct. A major therapeutic aim is to reactivate acetylcholine esterase with 2-PAM. Okay, another option is atropine is used to block the action of excess acetylcholine, because atropine acts as an anticholinergic drug in the case of organophosphate poisoning. Okay, other two options you people read yourself. Okay, then next we have question number 15. A 17-year-old boy was drenched with a 45% parathion solution. So parathion is an example for organophosphate, I believe. So parathion lung toxicity also very important. You people, one question on malathion parathion will also come. Which of the following effects would be least likely to occur as a consequence of exposure? So delayed neurotoxicity and several weeks of exposure. So you have to the main concept you have to remember is that organophosphate insecticides they cause acute toxicity within less exposure, like within 5 hours, 3 hours, 4 hours, 8 hours. After weeks of exposure, several weeks, this is not applicable to this particular thing. Okay, then next we have to see question number 16, last question in this video, that is organophosphate induced delayed neuropathy. One diagram I kept, no, OIDNP something like that is associated with, all the options are correct. TOCP, which is an organophosphate which will cause delayed neuropathy. Mass poisoning in Morocco as a result of cooking with contaminated vegetable oil. So in these two historical incidents, you have to remember, one was Jamaican incident, ginger jack paralysis. Second one is mass poisoning in Morocco. Okay, here the cooking oil, vegetable oil was contaminated with this organophosphate pesticides. And third one is paralysis and axonal degeneration, right? A lesion described as dying back process. What is dying back? I have discussed in detail in the previous. So this is a clip figure. This is a newspaper taken clip taken showing the example of mouse poisoning in Morocco. Okay, so hope from this video you were able to learn about the hen, chicken, OECD 419, OECD 443 also, and we have seen ginger jack paralysis. Okay, some of the antidotes for organophosphate poisoning, cholinergic syndrome, what are the symptoms are there. So though this video is bit lengthy, but I try to cover as much concept as I can, and we have discussed important things, 16 questions, and these questions are from recertification questions from ABT only, right from year 1999 to 2009. Okay, hope you will be able to learn from this video. Okay, thank you so much. Be curious. For any questions, please comment. You can also write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on Board. All the best for your exam. Thank you.